COVID-19 awareness for gyms. This tutorial is a joint initiative between New South Wales Health and Department of Customer Service. Training objective. This guidance is for gym owners, operators and employees in gyms. It will help you to understand and address the key COVID-19 risks in gyms. It is strongly recommended all gym staff complete this COVID-19 awareness in gyms module. Training topics. This guidance will cover COVID-19 safety plans for gyms, well-being of staff and gym users, physical distancing, hygiene and cleaning, ventilation, record keeping. COVID-19 safety plans for gyms. All gym staff must be familiar with the safety plan. The safety plan may need to be updated from time to time as restrictions change. Make sure your safety plan is up to date by checking the nsw.gov.au website. An up-to-date copy of the safety plan must be kept at the gym at all times. All indoor gyms that are open to the public must have a COVID-19 safety plan. This includes gyms in a hotel or workplace. What is COVID-19? COVID-19 is a new strain of coronavirus. Coronaviruses cause respiratory infections. As it is a new virus, there is limited immunity to COVID-19 in the community. This means that COVID-19 can spread widely and quickly. Most people who develop COVID-19 will only have mild symptoms, but some will require intensive care in hospital. How is COVID-19 transmitted? The virus is spread from person to person through close contact with a person who has COVID-19, even if that person has no symptoms. The infected person may cough, sneeze, or breathe out contaminated droplets and airborne particles, touching objects or surfaces that have droplets from an infected person. The COVID-19 virus can persist on surfaces for a few hours or up to several days depending on the conditions. For example, type of surface, temperature, or humidity of the environment. Once contaminated droplets are on the hands, they are easily transferred to the mouth and face. About COVID-19 and gyms. Transmission of COVID-19 in gyms has occurred in New South Wales. COVID-19 can be transmitted in gyms by high-intensity activities such as weightlifting, dancing, particularly Zumba or similar classes, spin class and cardio machines that increase respiratory breathing and exhalation of air, sharing of equipment, contamination of common high-touch surfaces. Activities requiring close contact, such as spotting in weightlifting, which requires close contact between individuals. Well-being of staff and visitors. Staff, volunteers and gym users who are unwell should not enter the gym. To help prevent transmission, it is essential to remind staff, volunteers and visitors who are unwell not to attend the gym and to get tested for COVID-19. Signs and symptoms of COVID-19 to watch out for include fever, 37.5 degrees or higher, cough, sore throat, shortness of breath, difficulty breathing, runny nose, loss of taste, loss of smell. Other reported symptoms of COVID-19 can include fatigue, muscle pain, joint pain, headache, diarrhea, nausea, vomiting, loss of appetite, unexplained chest pains, and conjunctivitis have also been reported as symptoms of COVID-19. In more severe cases, infection can cause pneumonia with extreme difficulty breathing. Be aware of the signs and symptoms of COVID-19. Illness can be mild, so even people with only one symptom should get tested and self-isolate straight away until they receive a negative result, usually within 24 hours. The time between when a person is exposed to the virus and when symptoms first appear may range from 2 to 14 days. For this reason, people who have been in contact with a confirmed case are asked to self-isolate for 14 days to ensure the New South Wales community is protected. Physical distancing. Capacity in gyms. Minimizing close contact helps minimize the risk of COVID-19 transmission. Make sure the number of people in the gym does not exceed the maximum capacity allowed in the COVID-19 safety plan. Make sure any gym or recreation classes or sports activities do not exceed the maximum capacity allowed in the COVID-19 safety plan. Remember, the COVID-19 safety plan will set limits to the number of people allowed in the gym. Physical distancing. Equipment stations. Refer to the COVID-19 safety plan for specific distances. Ensure gym users or groups of users maintain the required 1.5 meters physical distance from people they don't live with. Position equipment with adequate space between stations, and so patrons are not facing each other when using the equipment. Physical distancing, spacing in high-use areas. Manage the number of gym users allowed at any one time in high-traffic areas, such as change rooms, weights and cardio areas where there is an increased rate of breathing. This is particularly important during peak times. Hygiene and cleaning. Cleaning is vital to prevent transmission of COVID-19 through contaminated equipment and areas. Given the high usage and turnover of patrons in gyms, frequent cleaning and disinfection of frequently touched surfaces is strongly recommended. As part of a comprehensive cleaning routine, you should frequently clean and disinfect surfaces that many people touch, such as door handles, stair rails, water stations, bathroom amenities, and storage units such as lockers. At a minimum, frequently touched surfaces in gyms should be cleaned and disinfected at least twice daily. Shared gym equipment should be cleaned between users. Consider taking commonly used items, mats, individual weights, out of circulation and cleaning them completely at least twice a day. As part of a comprehensive cleaning routine, all staff must be educated on the importance of cleaning, correct cleaning techniques, correct chemicals and strength. Gym users are instructed to clean equipment after each use. Gym users have access to cleaning disinfection wipes to clean and wipe down equipment between use. Supervise consistent and correct use. Hand sanitizer is available throughout the gym. Make sure to establish your cleaning routine. Don't forget, you are required to clean your equipment after each use. Ventilation. Ventilation in the gym. How the gym is ventilated can help reduce the spread of COVID-19. Use outdoor settings where possible. Use large, well-ventilated indoor spaces if you can't go outside. Open windows to increase natural ventilation where possible. Regularly inspect, maintain and clean the gym's heating, ventilation and air conditioning systems. Assess and adjust the level of air circulation in the gym. One option is to use a CO2 monitor, especially in smaller, more confined areas of the gym. Open or well-ventilated spaces reduce the risk of transmission of COVID-19 because infectious droplets and airborne particles are more quickly diffused in the open air than in spaces with less ventilation. Direct fans towards the ceiling or floor so they don't blow air from person to person. Increase airflow from outdoors to indoors and avoid using recirculated air where possible. For example, consider running mechanical air systems at maximum outside airflow for 2 hours before and after spaces are occupied. Consider disabling ventilation controls with automated settings that reduce air supply based on temperature or occupancy. Consider consulting relevant technical experts, such as ventilation engineers and industrial or occupational hygienists for technical advice. Keep the airflow like an assault air bike wheel. Record keeping. Supporting contact tracing. To support COVID-19 contact tracing, you should make sure gym users' contact details and sign-in times are recorded electronically, for example by QR code or swipe card. Review sign-in processes to ensure records will be complete. Rapid and complete contact tracing facilitates a quick return to normal business operations. Delays in contact tracing can place people at risk, and the virus can continue to spread throughout the community. Limiting points of entry and exit will help your record keeping. Have a floor plan for your gym with clearly marked activity zones. This supports more accurate and precise identification of patrons' locations if contact tracing is required. Contact tracing needs to identify all people present in the same area as the infectious person. Archived CCTV footage may also assist contact tracing. Note, having identifiable activity zones may help. Thank you. To complete your training in this module, please proceed to the quiz. Click on the link below this video to start. The logo for the New South Wales Government.